Assalamualaikum and good afternoon to Dr. Sheila and fellow friends. My name is Aizat, a master student in sports coaching. And today I will be presenting my research proposal, which is the effect of meal ingestion before versus after exercise on body composition, substrate utilization, appetite response, and energy intake among overweight/obese population. As an introduction, the recent National Health and Morbidity Survey in 2019 reported a prevalence of overweight as much as 30.4% and obesity as much as 19.7%. So if we combine both numbers, about 1 in 2 adults in Malaysia were overweight or obese. This is very significant as obesity are at major risk for developing a range of comorbid conditions, including cardiovascular disease, diabetes, kidney disease, cancer, digestive diseases, musculoskeletal disorders, respiratory problems, and psychological issues, which may significantly affect their daily lives as well as increasing mortality risk. Conventionally, regular physical activity or exercise is often recommended as a strategy in prevention or management of obesity. However, exercise training alone without changing dietary habits is not always effective for weight loss unless the physical activity levels are high and for longer duration of time. And to mention, one of the popular dietary habits change is in terms of fasting. That is why my research is looking into the changes or into the diet that is fasting, which is meal ingested after exercise, which is exercising in a fasted state, or meal ingested before exercise, which is exercising in a fat state. And there are plentiful of studies which investigated this role of nutrient exercise timing in modulating body composition and or energy intake, as well as differences in substrate utilization during exercise in a fat versus fasted state. Furthermore, it is on lean, healthy individual. This is the problem, whereas that is what my study aims to solve this problem, which is the purpose of the study is to investigate the effects of meal timing in regards to exercise performed on overweight/obese individuals. And I will also measure multiple dependent variables such as body composition, substrate utilization, appetite response, and also the energy intake. So the research objectives are to determine the effects of meal ingestion before versus after exercise on body composition in overweight/obese population, and the substrate utilization, and then the appetite response, and finally the energy intake. So the research design will follow a randomized experimental design involving 18 visits to the laboratory. And this is the flowchart of the study. After recruitment, they will be screened based on their inclusion and exclusion criteria. If they're eligible, they will first do a VO2 max test, which will be later used during the intervention. And the baseline measurement are the blood taking, 3-day food diary, and body composition. As for the study instruments, I will later explain in the following slides. So the participants are divided into 3 groups, which are the control, no exercise training, and meal ingestion protocol. The fat and exercise group, which they ingest their meal, they have their food, and then they exercise. So they will follow a 3 times exercise session per week at 50% VO2 max for week 1 to 3, and then 65% for the following week. And for the duration, 30 minutes for week 1, 45 minutes for week 2, and 60 minutes for the following week. And then, of course, they ingest their meal before exercise. Breath collection is taken 10 minutes, every 10 minutes, and then the VAS score is also taken, and then the 24-hour day recall taken the next day. And similarly to the ex-fat group, okay, all the things are similar except for they ingest their meal after exercise. So that is why they're the ex-fat group. And then, of course, the baseline measurement are repeated, or the measurement are repeated, same as the baseline at the mid-training, and of course the post-training, and then the study is completed. So for the conceptual framework exercise, we can do it in either fasted state, which means there is no food in our body to utilize or in the past hours, or we can do exercise in the fat state, which we have a meal prior to exercise, and this can affect the substrate utilization use, which is the carbohydrate and fat ratio, which may affect the body composition. But of course, energy intake is the main primary factor for the changes in body composition, because it depends on our calories, but our calories may be affected by the appetite response. If we feel hungry, we may increase our calorie intake. If we feel full, it will decrease our energy intake, and of course, it will be used to reduce our weight. So for the research subjects, they will be recruited to multiple medias. For the inclusion criteria, of course, they're Malaysian, age 18 to 30, regardless of gender, race, religion, education background. They must be literate in Malay or English because that is the main language used for the study. Categorized as overweight/obese. This is based on their BMI. And then they must be healthy, which means they do not have any medical illnesses or have an injury for the past 6 months. And of course, pregnant women are excluded from the study, and they not take any medication or dietary supplements. If they pass all the inclusion criteria and they pass the exclusion criteria, they will be eligible for the study, but they will be later explained in detail about the study, and once informed consent is obtained, and only then they will be included in the study. Of course, this research, since it is involving human ethical approval, will be obtained from the Human Ethics Committee of University Pendidikan Sultan Idris. So this is just a visual representation or schematic representation of the study. This is during the baseline, mid-training and post-training measurement, blood taking, 3-day food diary, and body composition. For during the training session, which is 3 times per week, they have 2 groups, which those ingest before exercise or ingest after. Of course, if they ingest food before exercise, they will be given a time to properly digest before exercising. And then VAS or visual analog score is given before and after exercise to determine their satiety and their hunger. And meal ingestion after exercise is done with a gap also after exercise to give time for the body to cool down. And then after their exercise session ends, is the time start for the 24-hour diet recall. So the next day, within 24 hours, the researcher will obtain their 24-hour diet recall, which may be done physically or through online call. So here are some of the research instruments. First, the anthropometry and body composition will be measured using stadiometer, which is the height, waist circumference using a tape, and the biological impedance analysis is used to measure the weight as well as their body composition. For the substrate utilization measurement, breath by breath measurement of VO2 and VCO2 during the exercise will be collected using a computerized gas analysis system. As shown in the picture is an example of one of the tools of the breath by breath measurements. And then the data will be collected and then analyzed to measure their substrate utilization ratio. And then for the appetite questionnaire, we'll be using a visual analog scale, such as you can see in this picture. On the very end of the scale are the very extreme. So on the left side is such as example, I am not hungry at all. And on the right side, on the extreme end, is extremely hungry. So the participants will tick or will mark what they feel based on this scale. And then for the blood sampling and analysis, it will be obtained from antecubital forearm vein at various time points as stated during the schematic representation. As you can see, it is obtained. So blood samples will be collected and transferred into a vacuum container containing EDTA, and immediately the tubes will be placed in ice, of course, to preserve the quality of the blood to be measured later in ELISA. But of course, those who take the blood are those who are certified to do so. So not me, but a certified personnel such as a nurse. And for the dietary assessment, there are 2 types. The 3-day food diary, which is done during baseline, mid, and post-training. It is to measure or to look at the dietary pattern of the subjects. Meanwhile, the 24-hour is to measure the difference after their training. So 24-hour after their exercise, and we will see changes in terms of their energy intake, as it is one of our dependent variable. And both will be analyzed using a Nutritionist Pro software to measure their energy or calories to be specific, and other nutrient intake. For the data analysis, all data will be analyzed using SPSS. So normality of the data will be checked by the Shapiro-Wilk test. Homogeneity of variance will be confirmed by Moxley's test of sphericity, and a greenhouse Geiser correction will be applied to the degrees of freedom if the specificity assumption is validated. One way ANOVA will be used to compare differences between groups in baseline characteristic, appetite biomarkers, energy and macronutrients intake, and body composition. A two-way ANOVA will, with repeated measures, which in the group times the time, will be used to compare the differences in fat oxidation and carbohydrate oxidation, appetite variables, appetite biomarkers, energy and micronutrients intake, and body composition between groups and over time. And finally, paired sample t-test will be used to test the difference of each time point from baseline within groups separately, whereas an independent t-test will be used to test the differences between groups for each time point. Normally, distributed data will be presented as means and standard deviation unless otherwise stated, and the statistical significance will be set or accepted as p less than 0.05%. So that is my presentation. So thank you. The questions I will answer